You know what I've been seeing lately, which I find very interesting, and I certainly want your opinion on this. On social media, I am seeing clear aligner brands advertising, saying, "You want straighter teeth? Just click this shop now, click this button right here, and we can get you started with some clear aligners." What is your opinion on that kind of advertising for something like having to do with your smile?
If it only had to deal with your smile, it might be okay, but it has to do with your health. And so every time you endeavor to move a tooth, your teeth should be carefully examined by a doctor. The doctor needs to assess the gums.
An expert.
The doctor has to know exactly where to move the teeth. And beyond that, the doctor needs to monitor the teeth as you go through treatment. And monitoring is more than just looking at a picture. Monitoring is you have to touch the gums to see how healthy they are. And so an in-person visit goes a long way with ensuring that your teeth and your treatment are progressing.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today, we are so excited to talk about comparing traditional braces and clear aligners with Dr. Gurman.
That's going to be good because I know a lot of people are like, I could never do braces. I'm just going to make sure I do something where people can't see until the change has happened, right?
Right.
Dr. Daniel Gurman is the founder of OrthoBrain and Gurman Orthodontics. He was named the Distinguished Alumni from his orthodontic residency and served on the faculty of The Ohio State University. I can't wait to talk to him and learn all about comparing these two, traditional braces and clear aligners.
I want to hear.
Me too.
Hello, Dr. Gurman.
Hey, Dr. Gurman.
It's very
So
good to
have
be
you.
here.
Thank you for coming.
Thank you.
So we're comparing traditional braces and clear aligners today, right? Let's start at the beginning. Why did you decide that you wanted to get into orthodontics, treating people's teeth?
Actually, my parents decided for me. My mom.
Okay.
She said, "You will be a doctor."
Okay.
And you
That's what
said,
you're gonna
okay.
be.
So
You will be a
that's what I
doctor.
have to do to my son.
I have to be a doctor.
Okay, tell them.
But I had the option of becoming the kind of doctor that I wanted to be. And I found the idea of working all the time, doing operations, those types of doctors that they're always in the operating room and they're never around their family. They don't go to the kids' events and things. I didn't want any part of that. So I had to find a kind of doctoring where I could see people that wanted to come to me and were less likely to have any suffering going on. So with orthodontic teeth straightening, people aren't sick, they're not infected, they're not injured. They come to me because they want to improve the way they look and the way they feel.
Right.
And we don't have all the emergencies. So it was a way for me to touch lives in a really profoundly powerful way without having the baggage that comes with being a surgeon kind of doctor. So orthodontics was perfect for me.
But I mean, still a lot of work to become an orthodontist. You attended Case Western Reserve University School of Dental Medicine, but that was after having gone to undergrad, right?
Correct.
And then what happened after that?
So if you do really well in dental school,
Which you did.
and you finish right up at the top of your class, then you might get into one of the 50-some orthodontic residencies that are in the United States. It's very competitive and it's a very rigorous path to get to that point, and you pay tuition all the way through. So it's a huge commitment to become an orthodontist.
Yeah.
And along the way, you got married and decided you want to just start having a bunch of kids
You
too,
have
right?
7
You have
kids,
7
right?
kids.
Yeah, would you like one?
I got 3 of my own. I don't need any more.
And I got one and we're good. Thanks, though.
Yeah, no, they're all awesome. Yes,
How many
we go-
grandchildren now?
We're up to 4 grandchildren. And
Are
it
you-
is the greatest. It's one of those things, you can't get it unless you are one. You have to be a grandparent to really appreciate it.
Yeah. So it sounds like you delivered for your mom which is becoming a doctor.
Yes.
You delivered for yourself in becoming the kind of doctor that gives you the kind of lifestyle that you wanted to have. You're a family man. You have lots going on when it comes to your practice because you're the owner of German Orthodontics and OrthoBrain, which is a dental practice growth system with a total solution that makes integrating orthodontics easy. Break that down.
So
Yeah.
you're teaching other dentists? Is that
Yeah.
Yeah, it's a great question. So a little bit of background. There are between 500 million and a billion people on this planet that would benefit from orthodontics that haven't received it. The number of people that are missing out on the confidence and opportunity that comes with having a great smile is enormous. I had a really large orthodontic practice. Since we're all best friends now, I'll share something. I treated about 30,000 patients.
Whoa.
About 30,000. And does that make a dent when you're talking about hundreds of millions? No. I've educated thousands of dentists and orthodontists. Barely makes a dent. So what we did is we developed a method to enable dentists, whether they're orthodontic specialists, general dentists, pediatric dentists, to deliver orthodontics at a very high level. And this creates access and affordability to orthodontics so that more people can get to somebody who is qualified to deliver great orthodontics. This is all about
incredible.
transforming the way healthcare is delivered so that experts can enable others to do it faster and better, more predictably.
And you gave back to the world, to society in a way that, I mean, what a legacy you've left. That's incredible.
Well, I appreciate you noticing that, and it is what drives me to work around the clock right now. Now that the last child is 18 and out of the house, I can work even more, and my wife and I are passionate about creating the opportunity for everybody to get orthodontics wherever they are, whether or not there is an orthodontic specialist nearby or not.
That is really incredible.
Now let's start at the beginning. Since you are our expert, let's start at the very beginning.
Yes.
We're going to be comparing traditional braces and clear aligners today. Well, you are going to be comparing those
You're
for us.
going to educate us.
So if we start at the beginning, what are traditional braces and how do they work?
So traditional braces are thought of as little metal squares or rectangles that are in the front of your teeth. And each one of those has a little receptacle, a slot that receives a wire. So you have the little metal squares that are on the front of the teeth and a wire that is inserted, and it's the wire that helps move the teeth. Those are traditional braces.
That's what we had growing up, for example.
Many, many years.
Many years ago.
And they work. And they've been around for over 125 years. And they still work. Okay? So traditional braces are out there, and I would say at least half of all orthodontic patients receive braces as part of their treatment. They're still widely used, even with the advent of aligners.
What are they used to treat specifically?
Yeah,
Braces.
why would someone
Yeah,
get
why would somebody get
traditional
them?
versus aligners, for example?
A person would choose metal braces over aligners if the doctor suggests that that's going to be the best solution for them. So that would be the number one reason.
Okay.
There are patients that want to wear the braces because they know they're forgetful. So if you happen to have a child and your child can't find their glasses, they can't find their shoe, they can't find their backpack, they lose everything, then braces would probably be a better solution for them than something that's removable like the clear aligners. And to take it one step even deeper, there are certain problems with teeth that are better treated with braces and others that are better treated with aligners. And that circles back to the very beginning where the doctor may recommend one over the other.
Give us an example. What's something that's better treated, or what's a problem that you're trying to fix that you would say, you know what, metal braces for this particular issue? What would the issue be and how would you work to fix it?
Yeah, it's a great question. About 2% of the population has a tooth that is stuck in the jaws and it doesn't come down.
Oh.
It's typically, we call them the eye teeth up here.
Okay.
I've seen
Right?
Yeah, I've heard
Where
that.
somebody has
yeah.
a tooth that's stuck and it just doesn't come in. You've had friends that have had it and maybe you just didn't know it. With something like that, braces are much more predictable.
Okay.
It's not that you can't do it with aligners, but the braces are going to be more predictable. And that would be a great example of where you would choose one over the other. And so I use an analogy. If you happen to travel and you're going on vacation and you're going to go on vacation to a place that's about 20 miles away, you could take an airplane, you could take a car, you could take a train, which is going to make the most sense,
Okay,
right?
yeah.
Now,
that
on the
makes
other hand, if
sense.
you're going to go across the country, that airplane's going to look a lot better than the car.
For sure.
Right,
Right.
For
right.
sure.
And so it doesn't mean that you can't go cross country with the car. Of course you can, and people do it all the time. But an airplane might cost less and get you there a lot faster.
What are the different types of braces? Is it only the metal brace, or are there different types of braces now?
There are a variety of different braces out there. Metal braces, we'll call them teeth-colored braces, which are not completely teeth-colored, but they're close, and those are much more aesthetic. And then when you look at the different types of braces, there are different mechanisms that allow them to function. So there's a little bit of nuance with the individual braces. So there are many, many different braces manufacturers out there.
Okay.
So you said metal. I've heard of ceramic braces. How are those different from the metal ones?
Are those the teeth-colored ones? The
Yes,
ceramic?
the teeth-colored
Okay.
are typically...
okay.
So they can be made of ceramic, and there are other materials that can be used. But I think ceramic would be a fair way to describe most of the clear braces or teeth-colored braces.
Okay.
And they are more aesthetic, so they don't show nearly as
Than
much.
the old school with the metal brackets and all of that. Although, something tells me that some people want for their braces to really stand out and be seen, and they'll go the metal braces route. Are the metal braces less expensive?
In the practice, German Orthodontics, the fees were the same whether you had metal braces, ceramic braces,
Oh,
aligners.
okay.
In other words, a lot of times people think of dentistry as like going to the store. Well, I'm gonna buy metal braces. I'm gonna buy clear braces. I'm gonna buy
Right.
aligners. I'm gonna buy a crown on my tooth. It isn't really like that. What you're doing is you're getting the expertise in the service. So I don't really think of the product as having a different price tag, whether you straighten them with the metal
Yeah.
or the ceramic braces.
I see. And have you heard of lingual braces? Of course you've heard of it. I had never heard of lingual braces. What's that?
So lingual braces are braces that are on the inside of the
Oh,
teeth. So you can actually have braces placed on the inside of your
I've
teeth.
never heard of this.
And they have been around. I first used them in 1985.
Wow.
Do they work? Yes. Can you get a headache in your neck if you're the orthodontist because you feel like you're standing on your head to work on them? Yes.
Oh, right.
Yes.
Of
Yeah,
course.
that angle,
Right.
right.
And so it isn't so easy. And of course, our friend the tongue has to operate inside the
Oh,
mouth
yeah,
and having the
that's
braces on the
tricky.
inside. It's not the most comfortable. We had patients before aligners were invented. If patients didn't want their braces to show, and it wasn't unusual, we had news anchors that would come to us to have braces on the inside of the teeth, professional actors that would be on stage and can't have them, whether they're children or adults, and they would come in and we would do braces on the inside of the teeth. And for that, we did have a higher fee.
It's much
I
harder.
basically was looking upside down, head bent funny,
Oh,
using mirrors
gosh.
trying to work on the inside.
Twice as hard.
So it was harder.
Yeah.
But also, as a news anchor, you're expected to sound a certain way all the time.
Yes.
And I know when I had clear aligners at one point, which we're going to get into, if I had forgotten to remove it during the commercial break
gosh.
or right before the show, I would have a little bit of a lisp.
Of course.
And I talked because it was
I've
still
heard of that with the
especially at
clear
the beginning as
aligners.
you're getting adjusted to what that feels like, because it changes the
Exactly.
structure of the way the internal structure of how your mouth feels.
And your tongue. So
And your
what
tongue,
what
yeah.
exactly are clear aligners? Is it the same as Invisalign, or what are clear aligners? Can you?
So clear aligners, they're see-through plastic that fit over the teeth, and they gently move the teeth from crooked to straight.
Okay.
And Invisalign is a company that makes them. They're one of many
Okay.
companies that make them. So they're a
brand of
manufacturer of plastic,
I see.
kind of like Kleenex is a manufacturer of tissue.
Okay, that makes sense.
Yes.
And how long is the process to wear clear aligners? Is it the same as braces, 18 months to 2 years total, or just depends on the person?
Yeah, you did a great job answering the question. Yes, it depends on the
Fun, thank
person.
you.
Congratulations.
She
you
did her
got
research.
It.
Did my
Awesome.
research?
It does depend on the patient, as we would intuitively expect. That
Right.
not everybody is in treatment with braces or aligners the same amount of time. The amount of time, the research shows that people finish their treatment a little bit faster when they wear aligners versus braces.
Oh, interesting.
How much faster? The research shows about 6 months.
Oh, that's
that's
significant.
significant.
So
Yeah.
the last article that was written said 6 months less time in treatment with the aligners. And there are a variety of reasons why that may occur. I wouldn't allow that to be a factor in deciding which way you're going to go. I don't think that's the right reason. I think you go with the appliance that is going to give you the best possible outcome, because we're talking about creating a smile for life.
Yeah.
What is 6 months in the course of
Right.
Your whole life.
That's
your
true.
whole life?
But
Yeah.
if you had equal, like if each braces or clear aligners, were either one would do the trick, why wouldn't someone pick the clear aligners? Wouldn't they?
Yeah,
Okay.
you would logically assume that everybody would go with aligners if everything was equal. Price
Right.
was equal. You could treat a little bit faster with the aligners. Obviously, they're
Aesthetically.
they're better, and there's some other things that are very appealing. However, you have some people who know not to trust themselves.
Oh, okay.
And so they know that they're going to take them in and out, and they're going
Sure.
to lose them,
They're gonna
or
forget.
they're not going to be compliant by design.
I see.
Or maybe they sit at their desk and they sip on Kool-Aid all day long, and so they're going to turn their aligners pink, right?
Yes.
Because you have to take them out.
So
when you
take
do
them out every
something.
time you eat. You mentioned Invisalign. I think most people have heard Invisalign, even if
Yes.
you've never used that to treat your own teeth or have your teeth be treated with Invisalign. That's not the only company that makes clear aligners. Can you name some of the other popular brands?
Sure. And look, they spent a lot of money making sure that everybody has heard their
Sure
name.
did.
Right?
Yeah.
And that you
And
instantly associate
That's
brand
right.
recognition
It's brand
with
recognition.
that. Yeah.
So
with clear
it's
aligners.
so that is the name of their product.
Right.
And people, because of their expertise in marketing and also being first to mass produce, they have that name recognition. All right. And that's happened in many industries before.
Yes.
For folks who are senior to me, they'll remember if you wanted to get a car, like my grandparents, it was a Ford. Everything was a Ford. That's who
That's
mass,
what you get.
That's
they
what a
mass
car is.
produced
That's a
them.
car.
Yeah.
Car is
They
Ford.
mass
Ford.
produced them, and that was it. You didn't have any options. So that company was the first to do it in mass production.
Okay.
And so they have that brand recognition.
Mm-hmm.
When it comes to other companies, you asked me to name some of the other ones. And there's a company that you may not have heard of that is newer in this market in North America. They're called Angel Aligner. And Angel Aligner is actually a very big and successful company that makes aligners. They just hadn't been in North America. There are markets out in Asia where they're probably bigger than anybody else. And now they're in the States. They have a fantastic product and great service. Okay. Another company you may have heard of is ClearCorrect.
Mm-hmm.
And you may have heard of SureSmile.
I have.
And more recently, you would have heard of Simply Clear, which is part of OrthoBrain, which is
Oh.
what our company provides. And so if you look at the different companies, Angel Aligner is dedicated to serving orthodontic specialists. And so that is their niche. That's what they go after. And they're not interested in working with the general dentists. Simply Clear has a lot more general dentists and has a different, our model is just different. Yes.
I see.
You know what I've been seeing lately, which I find very interesting, and I certainly want your opinion on this. On social media, I am seeing clear aligner brands advertising, saying, "You want straighter teeth? Just click this shop now. Click this button right here, and we can get you started with some clear aligners."
So
I'm
you
not
don't
naming
have
a
to
brand.
go to a-
Yeah, and I'm like, wait,
Oh.
wait. There are certain things like I can buy a T-shirt from social media, but my teeth, my smile. What is your opinion on that kind of advertising for something like having to do with your smile, your teeth?
If it only had to deal with your smile, it might be okay, but it has to do with your health. And so
Oh.
every time you endeavor to move a tooth, it should be your teeth should be carefully examined by a doctor. The doctor
Oh,
needs to
that's
assess the
an
gums.
expert.
The doctor has to know exactly where to move the teeth. And beyond that, the doctor needs to monitor the teeth as you go through treatment. And monitoring is more than just looking at a picture. Monitoring is you have to touch the gums to see how healthy they are. And so an in-person visit goes a long way with ensuring that your teeth and your treatment are progressing as they should. So we've now talked about 3 models with aligners. You've got the model where you have manufacturers that manufacture aligners, and we mentioned a number of those companies. On the other extreme, you have a do-it-yourself, where you
Yeah.
open up a box
Oh,
and you put them in
gosh,
and,
no.
and
DIY
say your
I don't
prayers.
wanna do
And
that.
Say your
Yeah,
prayers.
say your
Oh,
prayers.
cross your fingers.
the
Uh-huh.
biggest provider of that has closed their doors, right?
Oh, interesting.
And
Thank you for
then
that.
with Simply Clear is a different model, and that is where, in addition to manufacturing the aligners or the braces, an entire virtual orthodontic team of world-class experts is helping the doctor who's delivering the care do it as fast and well as it can be done. So you've kind of got the three models. You've got the model where you get it from a manufacturer. You've got the model where the manufacturer has a doctor deliver the care, and then you have this third model with Simply Clear and OrthoBrain, where the dentist or orthodontist is delivering the care with an entire support team that's there to help them.
Oh, that's cool.
Definitely want to go the expert route with that.
yeah,
I mean, with
I'm
your
not gonna
health,
do
with
virtual.
your body. No, I'm
Yeah,
not doing
no.
it. I just wanted to make sure we asked that, because I know
I
a number of
think
the
that's a
people,
really- yeah.
number of people who are listening and who are watching have probably seen those same advertisements. And it's like, well, I mean, if it's a lot less expensive and I could just do this on my own with one click, why wouldn't I do that?
Well, now we know why.
Now we know why you should not do that.
Yeah.
Okay.
Well, you know what?
I'm
Right.
just going to say that doctoring still requires a doctor. And there may be some areas where doctoring is able to be performed without actually seeing a doctor in person.
Sure.
Dentistry right now really demands that you see a doctor, and the doctor has to go beyond looking. They actually have to touch the gums. How do you know about the mobility of a tooth and the health of a tooth unless you can actually touch it at this point, right?
Yeah.
So it's an emphatic recommendation. Go with a doctor.
I was just going to say, what are some reasons people would get bracers or aligners besides having a cosmetic,
Beautiful
improvement?
smile.
Yeah,
Yeah.
exactly.
Yeah, it's a great question. So, in addition to the benefits of a beautiful smile, which are many, and we could talk about that because there's good research on that, there is also the health and well being of the person. So, as you know, I'm an educator. I do not teach anybody how to be a crooked tooth straightener. I teach them to care for precious people that happen to have a set of teeth attached to them. So, when you're looking at holistic medicine, which I am passionate about, you start by looking at the face, and that's one of the things that I teach. That's what we do at OrthoBrain. We don't start by looking at somebody's teeth. We're looking at their face. We're looking to see, do they have dark circles under their eyes telling me that they have disturbed sleeping? There are things you can do orthodontically to help people who aren't breathing well, either during the day or the night. And we're looking at aesthetic issues beyond the teeth. How are they positioned within the face? So when you smile, you've seen somebody, when they smile and all you see are gums, and you go, the teeth could be straight, but that's not very aesthetic. Or somebody smiles and you can't see any teeth.
Sure.
Well, can we move the teeth so they fit the face? Can we move the teeth so the gums are going to be healthier than they are right now? Can we put the teeth in the right spot so if there's a missing tooth, it can be replaced properly and ideally, so the biting forces are optimized so that people can stop the cascade of dental problems? If you don't have time to do it right, when are you going to have time to do it again? So for many dental procedures that involve aesthetic work or replacing teeth or rehabbing unhealthy gums, orthodontics is the place to start.
And so another non-cosmetic reason could be like TMJ. What is TMJ?
I have
I've never
TMJ.
understood exactly what that means.
Yes, you do have TMJ. There's
Yeah.
one on the right and one on the left. It is the name of the body part.
Oh,
It is.
So
It
we
is.
all have
we
We
all
all
have
have
it.
two
Oh,
of them.
okay.
Oh.
It stands
you
for
go.
the jawbone.
Okay.
T is for temporal bone. M is for mandible, and J is for joint. So it just identifies, it's like saying shoulder, knee, back, hip. You've
Okay.
got all
I
these
have
joints.
shoulder.
I have shoulder.
So, yes, that identifies the part. When it's not working properly, it can manifest itself as clicking or popping in the jaw, or the jaw
Or
not
locked
opening
jaw.
all the way where it gets locked closed. It
had
could
that.
get locked open.
Yeah.
Very unpleasant.
Very
And some of those can be a side effect. Some of them, not all, can be a side effect of your teeth and your bite. How? I'll give you an analogy.
Please.
And that is, if somebody had a backache and they had bad back posture, what do you think the first piece of advice would be?
Straighten up your
Straighten
posture.
up your posture.
Fix your posture.
Sit up straight.
Is it going to make your backache go away? It might. It might not. Was it the right thing to do?
Yes.
Absolutely. Now get some additional therapy to see if discs and things need to be repaired. Think of your jaw joint as the same. First thing to do, give it a normal environment to function in. Let's get the top and bottom teeth matching the way they should. And a dentist can assess the health of your jaw muscles. And there could be problems with your bite and other problems that are creating extra activity of your jaw. It may be while you're sleeping, your jaw's not sleeping.
Yeah.
Your brain's asleep, but your jaw's still working like crazy and grinding and biting.
I do
right?
that.
There are things that your dentist and your orthodontics can do, part of which can be orthodontics or orthodontics in conjunction with specific treatments for jaws.
So when you were first answering that question, because neither of us really knew the definition of TMJ,
Right.
and you were saying, well, you have it on your left side, I was like, oh my gosh, he is diagnosing her from across the room. I just want to tell you, I was like blown away. I still am by your expertise. I still am. But so what you're saying is that in the cases of the clicking or the lockjaw, there are, and this is not for a cosmetic look, it can fix that by properly aligning how your teeth or how your jaw is with aligners or braces?
Yes,
Wow.
yes, but not for every patient.
Sure,
For some
sure.
patients, it will be a solution. For other patients, it will help them minimize further damage.
Okay.
In other words, yes, it still bothers me, but how much worse would it be if I hadn't corrected my posture,
Right.
Okay.
right? And for others, it will be in conjunction with some other remedies for it. So yes, it's fair to say, and it also dovetails or really goes right back to the beginning when you were asking braces or aligners.
Right.
And I happen to like the aligners for my patients that are having jaw problems
Oh, okay.
because then they're biting on these 2 layers of plastic which separates the teeth a little bit. And sometimes by putting something between the top and the bottom teeth, it breaks that pattern, the neuromuscular pattern, the pattern that your brain is giving your jaw to move around. And it's altered when you put the plastic between it.
Almost like putting Botox in your teeth.
It's
Stopping that muscle.
It's a brilliant analogy,
Yeah.
and there's research that shows that when you put something between the teeth, about 85% of the patients are going to feel better.
Yeah.
Not cured,
Well, I wear
but
it's the
better.
same as
That's
the mouth
great.
guard at night, right? So you
Yes.
don't dry. Exactly. Okay.
It's not that braces are the wrong treatment. It's just that having the plastic between the teeth seems to make it go a little bit better. And will braces help those patients? Yes, they can, particularly at the very beginning. Because when you first put the braces on, it's a little ticklish. Therefore, you're not
There you
biting down. And if you're not
Right.
biting on your
Yeah.
teeth, then all of a sudden you've broken that pattern.
Broken that chain.
When comparing traditional braces and aligners, which is better at preventing tooth decay?
That's a great question. I'm gonna first say that they would prevent tooth decay by putting teeth in the right position so you have access to clean them.
Okay.
Okay.
All right.
From the beginning.
So if you have
Yeah.
crooked teeth, it's very difficult to get to some areas to clean. So whether you use braces or aligners, you're going to be in a better position to maintain them. All right. Which of them is going to be less likely to have a side effect in terms of having anything happen to your teeth, like a stain on the tooth or a scar on the tooth or even, God forbid, a cavity? I would say that the aligners probably a little bit better because you don't have something mechanical getting in the way. The caveat and the real important point to remember is that aligners should be removed when you're eating and drinking. And if you don't remove them and you drink something that's acidic, it can cause a lot of damage. So this is like your consent, your little sticker that goes with it. That's kind of the
Yeah.
warning label.
Yeah,
When you
small
wear
print.
aligners, take them out when you're drinking
Even
and
water?
eating.
Or no?
The water's not going to hurt you.
Okay.
But if it's flavored water, it can
Yeah.
be
Really?
devastating. Flavored
Because you
wine.
have to think about it. As someone who once had clear aligners, I knew to take them out. And I mean, the amount of money I spent on them, I'm like, I'm going to do exactly, I'm going to follow
Yes.
the instructions of my orthodontist. But I'd seen people keep them in as they're drinking their coffee, drinking their tea. Not only is it staining your teeth, but think it's just like sitting right up next to your teeth and it's keeping it there. But here's what I don't understand. How can someone keep them in and eat? It would feel so uncomfortable
Yeah,
to
that's
try
weird.
to chew.
Yeah.
Have you seen that?
Oh, yes. I've seen it.
What?
Yes. I have seen it. I've seen very smart people that don't follow instruction and
So it's not
think
that
that
they're
they're-
just forgetting; they're just not following.
You couldn't possibly.
they,
You
for-
feel
they forget to
them.
take
Oh,
them
they
out on
forget.
purpose. Where, okay, I'm not taking them out. I
Oh.
know I'm supposed to, but I'm not taking them out. It's too inconvenient. I don't want anybody to see. Whatever the reason is,
Oh my
smart
gosh.
people will actually do something like that. So that's why I wanted to make sure that all our listeners and viewers know, take your aligners out when you eat and drink. And people associate water with being good. Water that is untainted is good. Water that has flavor to it might be damaging.
Okay.
When you have clear aligners, every time you have to take them out, there's this, it's so gross. It's just like a lot of saliva all the time.
Oh.
I found myself wrapping the saliva. I mean, it sounds so gross.
Oh,
No, because you're cleaning it from your mouth
Yeah,
and
that
then you're
makes
having to
sense.
put it in the case. Well, you have to clean them and then you have to brush them. Like
Yes.
there's a lot of work
A
that
little
goes
more
into
high maintenance.
Well, they are,
Yeah.
right? Would you say that having clear aligners is more high maintenance in terms of maintaining them as a patient between coming in to the orthodontist for treatment?
So, yeah, it's a fair point. The aligners are only used for 1 or 2 weeks at a time. So you get a brand new one every couple of weeks.
Oh, you do?
So-
yes,
so-
yes.
That's nice.
Because your
That-
teeth are moving.
Oh,
That
right.
helps. You keep the same set of braces from start to finish. The good news is, even if you get the metal ones, they never rust.
Oh.
Oh,
Okay, so you're gonna be
I didn't
fine.
even think about that.
No,
I
no
never
rusty
did that.
braces. That's not going to happen. So you don't really have to do much to maintain the braces themselves. It's more about the teeth. And for the braces, it's just a matter of keeping your teeth clean. For the aligners, you have to be smart about it. You don't want to cook them. You don't want to boil them. You don't want to put them in the dishwasher, right,
Right.
to clean them.
Yeah.
You want to remove them when you eat and drink and not sit on them. Think about this too. If you do have a hot drink, it can alter the integrity of the plastic.
Oh.
So remember, everything is made by little molecules,
total
and that's how
sense.
plastics work, and they're
Yeah.
temperature sensitive. So if you were to drink hot water and say, "Oh, well, the
Like
expert
tea.
said you can have water with them," okay, well,
Right.
what if you drink hot water?
Nope, they're gonna change.
Then it's probably not
Yeah.
good for your aligner.
That makes sense.
Because they're more pliable
Yeah.
and they're custom fitted to your teeth, right?
Yeah.
To maintain clear aligners, what is the best practice for that?
You'll want to brush them, and then there are particular products that your dentist will give you that are aligner cleaners and
Okay.
fresheners.
Like denture cleaners, but for aligners.
Exactly.
Okay.
So they will have one,
cool.
and it will be the product that they feel matches best with the aligner vendor that they're using.
Oh,
Okay, so not all the plastics are the same. So that's why I would check with your doctor.
cool.
Okay, it's that time. It's Ask the Expert time. This is when, Dr. Gurman, when our listeners and viewers anonymously get to ask you a question via us. Here's the first one. Our family dentist believes children shouldn't get braces until they lose all their baby teeth to save them from needing braces twice. Is this the case? Oh, he's got a fake buzzer. I like it. It's a
have heard
virtual
this
buzzer.
my whole life.
Same.
I mean,
You're a
is it-
mom of three.
Yeah. Is it an old wives' tale? I mean, I got
Yeah.
mine around 11 or so.
Same. I
Yeah.
got my braces around 11, 12. Yeah.
So that's
After
not
all my
necess-
baby teeth fell out.
Yeah.
So for many patients, they are fine waiting until all the permanent teeth come in. There are some patients that will benefit from orthodontics. Some of the orthodontics with braces, some of the orthodontics with the jaw growing appliances. So children should be examined by the time they're 6 to make sure that they don't have one of those problems that needs to be treated at that tender age while they still have baby teeth. So if a dentist is telling you do not do any orthodontic treatment ever until the permanent teeth are in, that is not
Dr. Kerr.
right.
Wow. So just take them to an orthodontist.
It
for-
would just be, I would get another opinion if
Yeah.
they say, I never have children have 2 steps of treatment, because there are certain indications where you absolutely positively need to have something done at that young age.
Right.
I'm not saying all children or most children, but there are a significant number of them that really need to have that treatment. And so it's an emphatic no. It's just not right.
Okay.
Okay.
Wow.
That's good to know.
Yeah,
It's
very
very
good.
enlightening.
Yes. This next person asked, can my kids do clear aligners instead of braces? I wondered that too.
So many people can do clear aligners instead of braces. It's the type of decision that you make in conjunction with the doctor, so the doctor can identify which teeth problems are best treated with braces versus aligners, and then bring that together with a parent and a child's
Yeah.
understanding of where their level of compliance is going to be and what they are looking for. In other words, anybody who's had a teenager, when you force things on them, they're not very well received, and you can expect a different level of compliance and participation with all aspects of the treatment, including the hygiene.
Okay, Dr. Gurman, this is the last one. Are braces that go behind the teeth just as effective as traditional braces?
I'm gonna say they can be.
Okay.
It's much harder, and there are very few doctors that have the desire to use those braces, so they're not as widely available. They have been around for a long time. I would say for most people that are looking for an aesthetic alternative to metal braces on the outside of the teeth, the aligners are a great way to go.
Okay. And behind the teeth, those are the ones called lingual braces, right?
Yes.
Okay.
It's so interesting.
Wow. I know. I mean,
much.
you blew my mind when you talked about taking a child by the time they're 6.
Exactly. I'm making an
I've always-
appointment.
so am I. I always thought that we really did have to wait till all of his baby teeth fell out.
Exactly.
And now he's got his grown-up teeth, and now it's time to
Same.
take him. But
Yeah.
thank you for that.
Fascinating.
welcome.
I know.
Yeah. Thank you, Dr. Gurman. This has been so wonderful.
So wonderful. So great having you here.
Yeah.
And your level of expertise is unmatched. Like, truly.
Yes, and what you've given to the world and
Yeah.
to society is truly commendable. Thank you.
Well, thank you. I appreciate the opportunity and have enjoyed every minute of this.
Aw, we appreciate you too. Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.